In this video today, we're going to discuss common muscle imbalances that lead to pain. If you are like most people out there today, you are struggling with some sort of ache or pain. You might even have recently injured yourself. So the purpose of this video and why you should care is that muscle imbalances can lead to structural damage over time and a significant injury. You are increasing your risk of injury when you work out or when you're at work and doing something strenuous. If there's an underlying muscle imbalance, you can hurt yourself. And basically, aches or pains should be looked at as a check engine light of your body. When you start feeling some niggles and things happening, that's just a warning sign that something in your body is out of alignment in terms of muscle length, strength, and it needs to be addressed because it can get serious. So the first muscle imbalance we're going to go ahead and address is a forward head imbalance. You've probably seen many people with this posture before, but the reason for this position is that it's because of upper back stiffness and loss of mobility and poor core muscle strength. Now the test for this would be standing up against a wall, trying to get your head, your shoulders, your butt, and your heels to touch the wall. If you are unable to get your head and your shoulders on the wall at the same time, where your head is sort of stuck in a forward head position, this is a forward head muscle imbalance, and this most likely could be because of upper back stiffness, tightness of your hip flexion muscles, also weakness in your core muscles and weakness in the back extension muscles. Also, tight chest muscles is a common cause for this posture. The second muscle imbalance I wanted to share with you is a protracted rounded shoulders. The reason for this is, let me first show you the test though. What you're going to do is position yourself on a hard surface. You can do this on the floor. Don't do it on a soft mattress because it won't be accurate. And you're going to ask a friend or a partner just to take a picture from you from behind, from the direction of your head, looking downwards towards your feet. If you find that one shoulder, for example, is not touching the floor, this would be normal right here. If one shoulder is sort of forward a little bit compared to the other side, or there's even a little space, this could be tight pecs, it could be a loss of upper thoracic mobility, could be tight lats or overdeveloped internal rotators in your shoulders. And this is many times common where you see one shoulder higher than the other. Could be any of those factors. So go ahead and give that test a try just to see if you might be a candidate for that type of muscle imbalance. The third muscle imbalance is uneven hips. To test for this, you're going to do a mirror test. You're going to just stand in front of a mirror, both feet facing forward, preferably about hip width apart. Take your index fingertips and place them on the front of your hip joints where that bony prominence is. It's also known as your ACIS. And while keeping your fingertips on the bony part of the pelvis, go ahead and look at the levels of your fingertips. Is one side higher than the others? In many people this is the case, and this could be tight dominant hip flexors on the one side compared to the others. Also tight hip adductor or tight groin muscles could be affecting the pelvis and maybe leading to a little bit of rotation. Also weak glute and hamstring muscles is a common cause for this type of muscle imbalance. So the last and final test here, I believe we're going to share, is the one foot turned out or externally rotated. Go ahead and try and do this standing in front of a mirror. Just go ahead, close your eyes, march in place for about 5 seconds, and then go ahead and come to a stop while keeping your eyes closed. Position your feet where you think they are equal and level and both facing forward. Go ahead, open your eyes and look down at your feet. You'll be surprised to see that many times one foot might be turned out a little bit more than the other. This is called an externally rotated foot position, and the reason for this could be weak hip abductor muscles on the side where the foot's turned out. It could be poor buttock and hamstring muscle strength, or it could be a tight iliotibial band. In the next video, part 2 of this video, we're going to share some exercises and tips on how to correct these muscle balances. If you like this video, hit the like button. Please subscribe to our Physical Therapy TV YouTube channel. We'd love to stay in touch with you, and thank you so much for watching this video.